Human challenge trials, on the other hand, are completely the reverse of that. Because we directly experimentally inoculate the participants on the study, there's no seasonality at all associated with this, and we can give our clients fixed timelines and fixed budgets so they can really plan effectively for that, and we can assure them that we can complete the whole study within the desired time frame because we're not at the whims of whether the virus is circulating in the community or at all.
Hello, you're watching Proactive. I'm joined by Andrew Catchpole, Chief Scientific Officer at hVIVO. Andrew, very good to speak with you. Could you tell us the key details of the contract signed with Traws?
Yes, certainly. So this is a contract to use our influenza challenge study, and it will be testing their prophylactic antiviral drug and looking for the efficacy of their antiviral. So we're really excited to be able to use one of our new influenza challenge viruses for this study, which we've developed in the last couple of years. These give really robust infection rates and really good disease profiles, ideal for testing antiviral candidates.
Andrew, how does the contract exemplify the integrated offering hVIVO has developed?
Good question. So what we do with this challenge study is it will use all parts of our business. So they're able to contract us to complete absolutely everything under the study. There'll be no outsourcing on this at all. So we'll be able to do right from the protocol design, the protocol writing, the recruitment team will be hVIVO's flu camp team, and then even the actual laboratory team as well will be analysing these samples. So right from the clinic, the writing, all the way through, we'll utilise right away across hVIVO's platform, even the stats and data management at the back end. So it's a really good example of a full service offering for this client, utilising many different aspects of hVIVO's expertise.
The trial recruits 150 participants, underlining a trend of larger study sizes for HCTs. Andrew, what does a larger ACT study enable for Traws and hVIVO's wider client base?
You're absolutely right. We have seen over the last few years a trend to these HCT studies getting slightly larger each time. And I think this is a reflection of biotech and big pharma actually recognizing that if you do a slightly larger study, you can answer more questions with it or get a bigger body of data and more in-depth analysis. So for example, larger trials, you can look at more endpoints, so endpoints which take a slightly higher end number than some of the other endpoints, so you can get a much broader depth of interrogation of the data. Or you can also do slightly larger trials where you have multiple arms. You may look at different dosing regimens in there. So they're really understanding that the power of challenge studies can actually answer more questions early up front and then de-risk the later stage studies having answered more questions already. So that's what we're seeing, this trend of these larger studies to really answer more questions with a human challenge and then de-risk the later stage studies.
Can you tell us why influenza is particularly suited to HCTs?
Influenza is a seasonal virus as well as a pandemic virus. So even with the pandemics, which happen obviously, every now and then, they can have a seasonality amongst them. So what we mean by that is, they're known as winter infections mainly in the majority. And this means if you're doing a traditional trial where you dose your subjects or you vaccinate your subjects and they need to become exposed to the pathogen naturally in the community, it can be really difficult to predict how long those studies are going to take, and indeed also how much they're going to cost, because actually you're totally at the whims of whether the circulation of that virus is a high year or a low year, and you really have no way of predicting that. And that means it's very difficult for smaller biotech, particularly because they can't predict how much money or time it's going to take to do. Human challenge trials, on the other hand, are completely the reverse of that. Because we directly experimentally inoculate the participants on the study, there's no seasonality at all associated with this, and we can give our clients fixed timelines and fixed budgets so they can really plan effectively for that, and we can assure them that we can complete the whole study within the desired time frame because we're not at the whims of whether the virus is circulating in the community or at all. So this is why all these respiratory viruses, which are very seasonal, they're ideal to do human challenge studies with because you remove that risk of the seasonality differences.
Well, Andrew, I hope you'll keep us updated with progress with the trial. Thank you very much for taking the time today.
Thank you very much for your time.
Andrew Catchpole, Chief Scientific Officer at hVIVO.